We need a massive increase in people who understand how to get value from data. We need hybrid individuals, doctors who code. We are in a new era. We've had a quarter of a century of evidence-based medicine, and no less than the President of the US is inviting us to think of a new era of data-based and more precise medicine. We've heard eloquently in the previous section what those data might be, and it really is the digital trace. It's everything, and it is global. Our 7.3 billion citizens on this planet contribute a rapidly growing digital trace. I won't go into that, but it spans the molecular to the particles in the air we breathe. And that is a fundamental insight, that whether you're interested in public health or whether you're interested in discovering new drug targets, to some extent you may be interested in common underlying data.
What is clear even from our audience, when we voted for more access, 50 or 55% of us were very much in favor of more access. So that means that it's on agenda.
We understand the issues and the challenges that payers and authorities have, but it's important that these very controlled, drastic ways of looking at prices of medicines are looking at where the issues really are. We see, for example, in our experience, our expertise is these generic and biosimilar medicines. As I mentioned before, the uptake, the creating competition is what brings access, as Adrian mentions, what brings sustainability. Where sustainability is in danger is where we see, for example, in countries putting in place mandatory price cuts from one day to the other.
To what extent do you think innovation in health is driven by the suppliers of innovation rather than what the patients actually want? And if so, what can we be doing about that?
How can we start discussion? What kind of society do we want to have? What kind of value should be the principle in society? That is what we say. Develop a common definition of valuable innovation. That starting from the patient need and society needs. This is what this conference is doing. This is what we did in Vilnius last year. And I think what we need now is to add the health economist, but we also need to add it, to lift it, to take it to another level. So after, I would say that demanding the Riga roadmap to lift this to the next level so we can have a discussion from a more broader view.